Okay, so we're going to go ahead and get started. And welcome to our virtual webinar event, and where we're going to be covering how to become a pharmacy technician in 3 months or less. And just a quick notice that we are recording this webinar, so that's why we've muted all the lines, and we request that you keep your videos off. If you object to being on during the recording, please sign off at this time. Although I'll note, if your webcam is off and you are muted, there won't be any visibility for you in the actual recording of this presentation. The major objectives that we're going to cover are, first, we're going to talk a little bit about the state requirements for working as a pharmacy technician. There are different training and credentialing requirements for each state, so we'll talk about that at a high level. We'll talk about the national certification process, because this is one of the best ways to get into the pharmacy technician field, so we'll kind of talk a little bit on how to go about doing that. And then we'll talk about the actual exam and some good tips and tricks on how to pass it. First, about me. So my name is Dr. Aaron Emmel. I'm a pharmacist. I'm the founder of pharmacytechscholar.com. I'm also an educator. I'm a former assistant college professor, and I'm an advocate, both for patient care and for people that want to get into the pharmacy profession, whether you're an aspiring pharmacist or pharmacy technician. So my mission is to kind of take that advocacy forward with our technician training platform. For state requirements, what we're going to start here, this is really important to understand what your options are to begin working as a pharmacy technician. I'll start with a disclaimer that each individual state has different requirements, okay? And each one is kind of specific to the state. I've tried to do a really good job at summarizing this information that I'm about to present to you concisely but accurately at the time that I made this material. But you really need to use the State Board of Pharmacy information as your source for up-to-date state requirements. So you always, at the end of the day, verify with your State Board of Pharmacy what is actually required to carry that registration or licensure as a pharmacy technician. Most states require you to register or to apply for a license as a pharmacy technician to work in that function in the pharmacy setting. And again, the best source of this is the State Board of Pharmacy's website. The best way to find that is to go into your preferred search engine and search for your state name, because that's going to be up to date. This is either going to end in .gov, or it's going to be branded to make it obvious it's an official state website or an official State Board of Pharmacy website. Some states have tiers of licensure, and again, this varies by state. Some states have just one registration status or one license status for pharmacy technicians. Some states have 2 different tiers. Some states have 3 different tiers. So I'm kind of providing an example here of a state that might have 3 tiers of pharmacy technician. So some states will have a bottom tier, where the pharmacy technician trainee is typically what these are called, which is a limited function license that you can apply for while you're going to pharmacy technician school or while you're attending some sort of pharmacy technician training program. Your job function is going to be really limited with this licensure status, but it's a good way to get you in the pharmacy so you can learn to eventually achieve that higher tier registration, in which there may be a middle tier where you would be a registered pharmacy technician or a first tier pharmacy technician, where now you can actually function as a pharmacy technician, but there may still be some limitations on the job functions you can perform compared to being a certified pharmacy technician or achieving that top tier of licensure. So that top tier, a certified pharmacy technician, can do more advanced functions, such as receiving medication orders, performing advanced compounding, doing functions like checking other technicians' products that they prepared, etc. The most desirable in the eyes of the pharmacy is the certified pharmacy technician, because you're more valuable to them because you can provide more functions in your job. State requirements may include, but are not limited to, some of these basic things I've listed here on this slide. So there's going to be an application fee, and these can range anywhere from $20 to $200 depending on the state. There's also basic education requirements. This is typically listed as a high school diploma or some sort of equivalency testing that you'll need at a basic level. Most states are going to require you to undergo a background check. You may have to get a fingerprint done. The application may ask you to list any felony convictions or other criminal history. Not that that would preclude you, but some of the state law, pharmacy law stipulations are going to note that, you know, there may be limitations if you have a drug-related offense or some other offenses that may be particularly concerning in the pharmacy environment. You're going to need to provide documentation that verifies your identity and your eligibility to work in the US. But I want to focus in on these last two here, credentialing or advanced training. So some states require you to have a national certification, which we're going to spend a lot of time talking about. And a few states require you to have advanced training, where you have to complete a state-approved training program or a training program that's nationally accredited by an education accrediting board or the American Society of Health System Pharmacy. And we'll talk a little bit more about that. So depending on the state and the requirements within your state, there's typically 3 different paths towards becoming a pharmacy technician. The first path is no preparation, and this is possible in some states. There's a couple states that don't even require you to register, and then some of the states that require you to register don't require any sort of certification or advanced training beyond, you know, the high school equivalent. This can be a good option for those that do well at learning on the job quickly and need to start working right away and can't afford to go through a training program. The downside is it can be hard to get a job because you don't have the experience and you won't be well prepared to do the job. So you'll need to do a good job at knowing what you can and can't do until you get that on the job training that makes you a competent technician. The middle of the road option is to get your national certification. And this is a nice blend of the no preparation approach or the school approach, because this makes you a good job candidate once you have the CPHT credential, and it does prepare you with a good knowledge foundation. You're not going to be fully prepared because you don't really get real on the job or hands-on training, but you get the knowledge that's needed. And once you get in the job environment, you'll learn really quickly. So this is a great road for most people to take if the state allows it. And then the most preparation you can do is going through a fully accredited training program. Some states require this, and this is a great approach because it provides you with very thorough training. These programs are typically required to have at least 120 hours, if not more, of actual hands-on on-the-job training. So this provides you with both knowledge and hands-on experience, with a major trade-off that these programs are typically fairly expensive, and they can take anywhere from 4 to 18 months to complete. So there's quite a bit of an investment to go through that sort of preparation. We're going to focus on the middle of the road approach because, you know, if we want to become a pharmacy technician in 3 months or less, this is really your only option unless you're lucky enough to go straight in without any preparation whatsoever. You may be wondering what you can do in your state. And again, this is a high-level overview. Every state's got very specific requirements, but if we were to just generalize, the green states listed here don't have specific requirements that you're going to need to have a national certification or that you need to complete a state-approved training program. So it may be possible to get a job without that preparation. It may be hard, and you're going to have to do lots of work up front to train on the job, but it may be possible. The purple states are going to either require accredited training or national certification. So that middle of the road approach will make you eligible for the top tier licensure in these purple states, as well as the green states as well, and make you a better job candidate. And then the red states here have some language that requires some sort of advanced training. This typically is going to be an ASHP approved accredited training program or a state approved training program. So example, a state like Florida, you know, you're actually going to have to find one of their listed programs and complete that before you can actually get your licensure or your top tier licensure. A state like Illinois, you can actually get a lower level licensure without the training. But to get to that top tier, you have to go through the accredited training. With that in mind, you know, the best path for you is really going to be up to what your priorities are. If you're not in a position to afford any training or even, a certification prep program, the no preparation option is good because it literally doesn't cost anything other than the cost of applying for the license. If your state allows that approach, it doesn't require any time for training up front, but you're not a good job candidate, maybe hard to get a job, and you're certainly not going to be competent. So there's a risk there, unless you're getting in with an employer that's got a really good training program and they're really careful about what they allow you to do in those first few months on the job. The middle of the road approach of getting your national certification, again, I think is a good blend. You're going to have some costs, which we'll explain in just a minute. And it's going to require some time, but it's certainly possible to do this in 1 to 3 months. And you'll be much better prepared, with some baseline knowledge of what you need to know as a pharmacy technician. And you'll make a great job candidate with that CPHT credential. And you may even get paid more than you would without that credential. And then the accredited training is certainly the most thorough approach. It makes you the best job candidate. It makes you more competent because you have that hands-on training. But these programs will cost quite a bit of money, especially if you do one that's a school-based program. You're looking at a 1 to 2 year degree program that could cost tens of thousands of dollars. There are some more abbreviated accredited training programs that may cost as little as, $1,500, but that's still going to require, 4 to 18 months of training, depending on the program. So out of those, I'll go back, out of these 3 options here, everything we're talking about going forward in this presentation is really focused on earning your CPHT credential. So that being said, how do you do it? So we'll go over the process of getting your credential here in this section. And I'll start with, what is certification? So certification is a credential. Okay, it's not equivalent to being a licensed pharmacy technician. It's just recognizing your expertise. So, and this is recognized as the CPHT credential. So on the About Me slide, I had my credentials on there. I'm a board certified pharmacotherapy specialist. So BCPS for me is a credential. You get to list that after your name in a professional manner. Getting this credential recognizes that you've attained knowledge or expertise in topics that are relevant to the duties of a pharmacy technician. And again, you get this by passing a national certification exam. There are 2 major providers of credentialing for pharmacy technicians. The most widely recognized is the Pharmacy Technician Certification Board, or the PTCB. There is another organization called the National Health Career Association, or the NHA. They do offer other allied health profession credentialing exams, but they have one for pharmacy technicians. We're going to focus on PTCB because in every state that requires or acknowledges national certification, the PTCB is recognized. I think most states also recognize NHA, but the PTCB, in my opinion, has a better brand in the pharmacy world. Now, to be able to sit for the exam through the PTCB, you have to be able to qualify through one of 2 mechanisms. One is being an experienced pharmacy technician already. So if you have over 500 hours of work experience, all you need is your employer to sign an attestation paper, and you can use that in your application to make you eligible. If you don't have any experience, you do have to complete a training program that the PTCB recognizes before you're eligible to sit for the exam. So when we talked about cost earlier, you have to find a training program to attend before you can actually sit for the exam. And the costs vary for this. They tend not to be as expensive as fully accredited training programs, although I'll note that the fully accredited training programs will typically also be recognized by the PTCB as well. These can be live and in person, or they can be online-based programs like we provide at Pharmacy Tech Scholar. So all that being said, if I were looking to become a pharmacy technician, this is what my path looks like. The first thing I would do is verify the requirements in my state by going to my State Board of Pharmacy website. I'd then go to the PTCB website, which is ptcb.org, and I'd read about the certification process. Their website is really well put together. It's very clear on what you have to do to apply, to prepare, what you should expect on test day, and what the process is after you take the exam. Once you know all that, identify a PTCB recognized training program, and PTCB has a directory for this on their website. Then you take the program, study for it along the way, apply for the PTCE, which is the certification exam, and hopefully pass it. And we'll take the rest of this presentation to talk about how you can set yourself up to do that. And I do want to make a few notes about taking the pharmacy technician certification exam. Right now, this is being done online primarily, although we are seeing COVID get better in a lot of areas. So they have resumed in-person testing in some areas, depending on those trends. So you may have the opportunity to do this in your own home on your computer, or in person at one of the Pearson VUE test centers. That's the vendor that handles all the testing. The application and scheduling instructions are on the PTCB website. You do need to complete your training program and have proof that you've done that within 30 days of submitting your application for the exam. Just a few tidbits that you need to know. A couple key points about the exam itself. There are 90 questions on the exam. They're all multiple choice. Only 80 count. They actually use 10 of them for research for future exams, but when you're taking the exam, you don't know which ones those are. So in your mind, all 90 questions are going to count. There's 2 hours total allotted. The first 5 minutes are a tutorial on how to go through the exam. Then you get 110 minutes for those 90 questions. And then after you submit the exam, you have a 5-minute survey before you leave the testing center or before you close your window at home. The entire exam is done on screen. So the multiple choice, it's all done online. There's no pen and paper or pencil and paper. Your calculator is also online. Your scratch paper is also on the screen. So you don't get to have anything with you in the test center. If you do it at home, it is proctored. So you have to have a webcam on. Now, if you go to the center, you can request special accommodations like a handheld calculator if they have one available, but I advise people to always practice like you're doing everything on screen, because that's typically going to be what you're going to experience on the exam. So that's a rough overview about the exam. And now, how do you pass it? Because I'll tell you, it's a challenging exam, especially if you don't have any experience in the pharmacy. But there are some good tips and tricks to set you up for success if you plan efficiently and do well in sticking to your plan. The topic outline for the exam is on the PTCB website. I've summarized it here. There's 4 major topic areas: medications, federal requirements, patient safety and quality, and order entry and processing. And as I've listed here, the percentage of the exam where each of these topics are represented. And I think this is really important information to pay attention to, because as you set out your study plan, you need to think about how much of each topic you're going to see on the exam, and then allot your study time accordingly. Too often, students will make the mistake of just focusing on calculations, for example, where that's just a small part of the exam, and they don't spend enough time studying everything else. So really make sure you're allotting your time appropriately. For the medication topic, there's actually quite a bit that you need to know. I've got some tips coming up in a few slides, so don't get too overwhelmed about this, but you're expected to know generic and brand names, drug classes, therapeutic equivalents, interactions, contraindications, side effects. I'm not going to read all these sample questions. I'll make sure you have these slides for your reference, but those are just some examples of the types of questions you may see for each of these subtopics. But in 2020, when they updated the exam outline, it's a little more robust for medication information. A lot of people think all you need to know is what generic name equates with what brand name. No, you actually need to know quite a bit more than that. But again, I'll provide you some guidance on what to focus on. There's additional medication information as well: contraindications, dosage forms, route and frequency, storage and stability, narrow therapeutic index, incompatibilities. So as you can see, it's a pretty wide topic area, and this is 40% of the exam. So you do need to dedicate quite a bit of time to learning this. For federal requirements, you need to know the requirements around handling drugs as waste. What are the requirements for controlled substance prescriptions and how controlled substances are handled by the pharmacy, meaning how they are ordered, how the inventory is maintained, what documentation you need to have, how you return them or destroy them when that's needed. There's also restricted drug program information you need to know, and also drug recall, how they are handled and how they are classified. For patient safety and quality assurance, you'll need to know high alert lookalike drugs, so examples of those and what those terms mean. What are strategies you can partake to reduce or mitigate the risk of medication errors? An important one is, what is the scope of the pharmacy technician's capabilities? So what questions can you answer and what questions must you divert to a pharmacist? If a medication error occurs, what are the reporting procedures and follow-up for that? What types of medication errors can occur and what are the processes that surround that? And as hygiene and cleaning requirements. So what areas of the pharmacy need to be cleaned with what substance and how frequently? And as a pharmacy technician, what type of personal protective equipment you must wear in certain circumstances. And then lastly, for order entry and processing, used to be compounding in general was on here, but now sterile compounding is a separate certification. So it's just non-sterile compounding now on the PTCE. Calculations, which again is an important one, and it's a difficult one. It's not too greatly represented on the exam, but you are going to spend quite a amount of time preparing for calculations. Abbreviations and SIG codes, how do you interpret prescriptions, what equipment is used in the pharmacy, how do you interpret all the numbers and dates that are on a prescription bottle or a medication stock bottle, and what the processes are for returning medications, whether or not they're expired or opened or damaged, etc. So I know that's a lot, and it can be overwhelming if you have no experience in the pharmacy, but I will tell you that this is definitely doable for anybody if you plan your study and allot enough time to prepare. And I really do think anybody can do this in a 1 to 3 month period if they have enough time to dedicate to studying. So some of this key recommendations I have for planning your study is to, number one, plan at least 1 to 2 months of preparation time. 1 to 3, I would say it can at least 1 to 2. I've had students complete our training program in as little as 2 weeks. To me, that's a little unusual, and I feel more comfortable if students take a little more time if they can. But study in small blocks. Adults learn much better in about a 20 to 40 minute range versus if you try to put in a marathon session of studying for 4 or 5 hours at a time. Make a game plan and stick to it. So look at that content outline for the exam and think about how long you are going to spend and what weeks you're going to spend for each topic. And don't get hung up on one topic. If you're struggling with medications, still move on when it's time to move on because you need to learn everything. Make sure you take care of yourself, eat and sleep well, and don't worry about cramming, the night before the exam or the morning of the exam. All the work you do in preparation is done over the course of that 1 to 2 months. The best thing you can do immediately before the exam or the night before is just relax. Get plenty of sleep, make sure you're ready and well rested to focus on the exam. Specific study tips, make sure the resources you're using are up to date. A lot of the books that are circulating out there that you can still buy on Amazon, they're outdated. They updated the outline in 2020. So make sure you're using a reference that is built towards those 2020 standards. Use flashcards and practice exams. That's no better way to prepare for the exam than to practicing, in that manner. The PTCB has an official app they partnered with somebody to make that's on the Android and Apple iStore. PTC Pocket Prep, that's a must. There's a free version. It's only got 10 calculation questions, but it gives you a great idea on what those questions look like on the exam. Make sure you focus on the outline and study accordingly. And if you're working in a pharmacy, take the advantage to learn on the job. Take a little extra time to be more intuitive and think about the things you might see on the exam and learn it on the job. I can tell you, going through pharmacy school, I did much better learning on the job than I did in a book. Specific tips for studying medications is to, number one, focus on the top 200. That doesn't mean you won't see a question about a medication that maybe falls out of a typical top 200 list, but don't waste any time studying medications that aren't that common. You're most likely to see common medications. Memorize drug classes first. That would be my priority. It's easier to equate indications, side effects, interactions, etc., with a class of drugs, meaning you might only have to learn, 30 or 40 different classes versus learning 200 medications and that information for 200 different medications. If you can look at a drug and say, okay, that's a beta blocker, and I know beta blockers are used for high blood pressure. That's a lot easier than knowing metoprolol is used for high blood pressure. And lastly, be realistic. Know that all generic, or try your best to know all generic and brand names in that top 200 list. If possible, do your best. Same with the indications, but those other things, side effects, interactions, contraindications, just focus on the big ones. And in our program, we do that. We just highlight like anticoagulants can cause bleeding. But other than that, you don't need to go into a full drug reference and know all the side effects for a given drug. I mean, I've been a pharmacist for 15 years and I don't know all that stuff. So just focus on the big things and make sure if you're still looking into a training program that they're structured to provide you with that streamlined information. Memorize, and moving on to studying calculations, a few tips here. Definitely know your unit conversions. This is really important. You're going to need to know that for most of the calculation questions on the exam. Learn cross multiplication. And again, I don't have enough time in this webinar to really get into this specific topic, but most calculations can be solved by setting up proportions or a series of proportions and using cross multiplication. Literally, if you knew your unit conversions and you know how to cross multiply, you can use that combination to solve almost any calculation question on the exam. So it's actually a lot easier to learn that than people realize. And practice using the screen only. So do your work using a blank Word document on your computer, a scratch paper, and an on-screen calculator, because that'll get you in the routine of being able to perform on exam day versus writing on a scratch paper and using your phone or a handheld calculator. And I'll wrap up by pitching our training program. If you're on this webinar and you're not enrolled, just to familiarize you with us. So we are a PTCB recognized education program. Our program covers all of the knowledge areas in the exam. So all 4 of those major topics and all of the subtopics that fall underneath them. We do have lectures and slides and flashcards and practice exams for each of those topics. We are now going to be hosting weekly virtual classrooms where our students can come on and interact with me and ask me questions or even just advice in general on the processes to become a pharmacy technician. And I do all the teaching for our actual program. And I am a pharmacist, so I feel like we have a really good foundation for that. We have everything hosted online, so you can do everything self-paced from the comfort of your own home. And again, I've had students do this in as little as 2 weeks. I really recommend taking 1 to 3 months, and we allow people to have up to 6 months of access, so you can really do it at your own pace. And we also provide a guarantee. So, if you aren't satisfied within 7 days of signing up, we'll give a refund, no questions asked. I may at least ask, what didn't you like so I can improve it. And again, we do guarantee that you pass, and if for any reason you don't, which I really hope you would, we provide a full refund if you've completed our course. And we do offer it for now at $249. Originally, we priced it at $499. But we're trying to make this as affordable as possible. So you can feel free to reach out to me if you have any questions about that. If you have any questions about the process of becoming a pharmacy technician, any questions about the exam, here's my email address. You can email me with any questions. We also have a Facebook site that you can go to and message us through there as well. And I think that'll wrap up this webinar. So I really appreciate everybody attending. And we'll be doing more of these in the future, so I'll make sure that you get notices for our future topics as well. And if there's anything you'd like to see, feel free to shoot me a recommendation and we can consider doing that for our next topic.